Listen, you know what, Doug? You take care of yourself. You don't worry about it. We'll take over. Don't worry. Thanks. Okay, bye-bye. Board,
I've got to be honest with you.
attention board, attention. Hold on, guys.
Wait, Diane's going to tell us something.
We've got a big problem.
What?
Doug Anderson, our star of PCM Precis, is ill.
Oh, no.
It is. It's big. So now, you know what? We're going to have to take over as the board. So we're each going to have to take a piece.
Well, listen,
Well,
you know,
there's no doubt about it.
the health and safety protocol, the Ebola's got to
I
be
know
ready.
exactly what we should be
You know,
doing.
the
Never
seat,
be
I like the seat.
Hold it.
Health and safety, everybody's got to be doing
I
it.
think it was the
We gotta
One
open
at a
with
time, but you know
Violent
what?
strategy
We got to
is
have a
amazing.
big opening.
We made a statement. They made a statement. And they made a statement not just on behalf of their 3,000 members in CCAC, but they made a statement for 60,000 of us in ONA, saying, you know what? We are not going to take this anymore. Heads up government, heads up employer, heads up public.
To see our union gearing up yet again in a new way, adding new energy and effort and design to our package on violence, very proud to see that happen. And I know with us leading the charge on this, that we will get some significant changes, and I also know we have to get those significant changes.
So for me, the highlight was the CCAC strike with our brothers and sisters. I think that has to be a priority for sure for this PCM. You know, we held strong. I'll tell you, it was so cold out there, and I come from the north, and I was frozen. And holding that line in Muskoka was a lot harder than I thought, I have to tell you.
Everywhere we go, people always ask us.
And this strike has made us more accepting of each other, better advocates, wiser thinkers, and it has made us even more committed to ONA, because ONA is committed to fairness.
My sister's been a care coordinator for 27 years, much longer than me, even though she's 11 months younger than I am. The first Wednesday of the strike, I left the picket line to meet my sister at Grand River Hospital in the oncology unit. And she was diagnosed with, hey, this is my personal don't cry button. Whoa, have to press it again. Anyway, I met her in the oncology unit, her and her husband, and she was diagnosed with cancer. The next day, my sister and her husband were on that picket line, walking with us.
But you know, that Ebola presentation was absolutely wonderful. The way the Deputy Minister came in and really looked to ONA for leadership, I thought that was absolutely wonderful.
You give us the most direct pathway to the most important people, the people who need to protect their own health. So if, you know, we're telling hospitals you have to implement barriers, you have to do X, Y, and Z. We're paying out about $14 million at this point to hospitals for equipment as well as the equipment that we've ordered. But you give us really good information that we listen to. I mean, you call me about your concerns about UHN.
You're dealing with it.
But if there was a more formalized mechanism, and you know, maybe it's okay if you two talk Sundays, but maybe it would be, we could corral more of the information if we had a structure or some kind of something set up so that we can get that information to you.
Let's expand it now. Let's expand it to the concept of workplace violence, where there ain't no directive, right?
Right,
I mean,
you're
there ain't no
right.
directive.
That's right.
I think when Dr. Bell mentioned that he was committed to helping us address the violence that our members face every day, that was a huge step forward. And the fact that we now have a violence prevention strategy, and that our members in the workplace will know they are part of the process to find a solution. They will identify when it happens to them, they will report it, they will grieve it. We are tackling a problem that has become a huge issue for our members every day.
And that education was just
was amazing.
just what we needed, I think.
So he was sitting in my office with me, and I was typing away doing some of my work, and he seemed to calm down a bit, and the conversation was pleasant. And he got up and he walked out of the room, and I thought I heard a noise, and I went out and he was kicking a frail nonverbal woman who was sitting in a wheelchair, and I immediately got over there, separated him, and called a PSW and said, you need to get him away from here and while I go pour him some medication. So I got a PRN med poured for him, and I went out to find him, and all she did was walk him away. She didn't engage him. Went down the hall to find him, and here he was, closed-fisted, pounding another nonverbal frail woman in the back of the head. I can't get past that part of the story without getting choked up. So I grabbed him, and I got him away from her, gave him the medication, walked him back up to the nurse's station, got a PSW to sit with him, and I walked in the nurse's station and shut the door and just lost it.
We need to be much more willing to file incident reports, and not just in terms of violence, in terms of all safety risks for patients and staff.
Knew I had to step
Listen,
it up.
this is, you like this all the time. You're just horrible.
What the? You can't have a PCM Precis without the grievance handling segment. What do you mean?
The issues in Region 2 have been very complex. Violence is on the rise across the province, including Region 2, where we had one of our members stabbed with a pen, physician harassment, labor board issues, which included duty of fair representation, was recently filed, and a host of other issues as well.
One of the trends we noticed across all regions is that discipline, very high. It's the highest trending. And I know that doesn't surprise any of you. The struggle in this area is very real for us.
The South District Servicing Team, I'm told, is the heart of ONA. I'm just saying what they tell me. I'm new here, right?
Our strength as a team is really in the diversity of knowledge, skill, and experience that we bring to the table. And it's my job now to continue to apply that nursing lens in the discussion.
Out of our PCM, there's a few things that are really, really important at this point. Number one, the solidarity of our 3,000 CCAC members that were out on strike. We've talked about engaging our members in the work of the union. This strike could have done nothing more than it did in unifying a group of what some people have called the sleeping giants. They're now awake, they're energized, they have passion, and they have a new understanding of fighting for their rights. And I'm hoping our leaders can go back to tell our members what ONA is doing in relation to violence, but also to instill in each and every member that violence is not part of our jobs.
I think the health and safety was just absolutely
Welcome
perfect.
to my life.
Panel.
On behalf of the Board of Directors, I'm Vicki
that the health and
McKenna.
safety
That's the
raised
March
above
PCM Precis.
Best PCM ever.